Ladies and gentlemen of the board, we are here today to discuss the rights of human beings, and is there a moral right to providing health care? In this discussion, we will cover several topics regarding this issue. Some of them will be known to you, and some of them may not even be considered. In this, we will be asking the question, do we have an obligation to provide health care to all? The answer to this question requires the focus of evaluation on the bioethical principles of healthcare. It is in this examination we will discuss and cover and discover the importance of different principles that will answer this question. A look at these bioethical considerations, the first being autonomy. This is the right of rational individuals to self-determine their healthcare choices in their lives. The next one is non-maleficence. The principles of ethics that deal with this is the philosophy to do no harm, and this is the basic of practicing medicine. Benefits, the ethical principle that guides us through the thought of doing good to others, and this is the primary focus that all choose when practicing medicine. And finally, justice, related to two different ideals, distributive and procedural. The first relates to the allocation of resources available, while the second relates to the methods in which these decisions are made. All of these topics are considered important for those who work in the medical field. In fact, most of us consider them a natural part of working in the medical field and are considered a mainstream focus for all who decide to work practicing medicine. As we will move forward, these topics of consideration are for the rights of healthcare of all who are in the world. The first of all I will be discussing is the Code of Ethics. The second would be resource allocation, and the third will be a cultural competency. With all of these three brought together, we can see that by providing healthcare to all, the important factors of curing most of the problems of the world and allowing those to relieve from the stress of having a medical condition. In the first of these, we have the Code of Ethics. Now, to understand this, we must look at professional contracts between the physicians and the publics and how they are deemed as social contracts. These are mandated by a sense of professionalism, expertise, and service. In conducting the practice of healthcare, it is important that individuals who are served have a clear sense of obligation and ethical principles provided by those in the medical field. These are mandated by laws. It is the expectation that the individuals will receive the help that is needed when a medical crisis occurs. This constitutes the ability to promote a healthy society and culture. Without the ability for individuals to receive care, episodes of pandemics and epidemics would occur and weaken the society in which we exist. Ethical principles that guide this code change to meet the needs of the society in which it exists. Following all of these codes of ethics gives the sense of the care provider and the individual receiving care to have a trusting relationship between each other and understand that they don't have to suffer through the dilemmas of life related to medical problems. The second is resource allocation. Now, this is an important topic because not all patients can be met at the same level. In this, we can examine how resource allocation should be performed. It is important to understand the problems that are present in your society and which medicine is performed. Since many needs and are requested, proper resource management and allocation is needed. Geographical areas that determine higher rates of medical disparity than others. This allows us to focus on a certain type of clientele. The key to this allocation is to determine what services are to be offered and what services need to be released to other institutions. Specialization of skills will allow us to network with other providers to see that all individuals will have the medical needs met. Once this network is in place, the role to promote a service to improve the personal health of all that require care will become evident, and all those that need medical help can receive treatment in one form or the other through the recommendations of their current medical provider into the network of systems of those who follow this system, including our institution and those that will team with us to provide a better network of services. In the final aspect, the cultural competency, in working with a diverse culture, it is important to move towards a better understanding of the different cultures that require our services. We live in a country that has many different cultures and social backgrounds and ethnic groups. This will mean that the training for our personnel will need to commence to promote a better understanding of this diversity and the cultures that we have here. One of the topics that we need to cover is linguistic skills. This will better promote the understanding between our patients and our staff. This will break down the barriers that prevent those who do not understand the procedures and the requests that are made by our professionals and provide them with the services that are needed. This can be accomplished through multilingual tools and signs that can be implemented by our facility for better understanding of the service and procedures for our clients. The training of our staff, including physicians, caregivers, social workers, and case managers, needs to commence to become a more familiar area for our clients to feel comfortable in understanding their health. With this cultural understanding, we can now spearhead a movement that will promote a better healthcare system around our society and in our country as well as the world. Looking at this quote, we have, in the end, professionals must meet the needs of individuals and communities or risk extinction. This is never more so true than in the healthcare field. We need to address this issue of healthcare for all to promote a better world in which we live in. In this exemplifying the ethics that we hold as medical professions, we can now note it is important that we move towards a time when all will have the right to medical care. I would like to thank you for your time and listening to the suggestions that I have, and hope that you consider the factors that I have brought forward so that we can now provide a service for the community in which we live and promote a better understanding between our clientele and the services that they need. Thank you.